All right, hi everybody. I'm Dr. Samantha and I'm a chiropractor at HealthWorks. At HealthWorks, we are in an integrated clinic. We have chiropractic, we have physiotherapy, we have physical trainers as well. So today we're just going to talk about the effects of prolonged sitting. As we all know, with MCO and everything, we're always sitting at home. Sometimes we don't even sit in the correct position. We sit in very uncomfortable positions. So I just want to talk to you guys a little bit about it. Share with you some information about MCO, the current situation, how much stress it's put onto people's backs, and we'll go from there. So, with sitting, for example, let me tell you about Matt. There was a client once, he used to work from home. So pre-MCO, he already worked from home. He already sits down all the time. And he comes in one day and he can't walk. And I asked him what happened. And he told me, he said, basically, he always has pain. He's just like all of us. He sits at home, he looks at the computer screen. Maybe at the end of the day, he has some pain, but doesn't matter, right? We'll just ignore it. We'll go to sleep. Maybe we pop a Panadol if it's really bad. And then the next day, it should be okay. Maybe it's on and off. On holidays, it gets better. On certain days, it gets worse. And on and off, it kept going on to a point where he just didn't know what to do with it. And one day he woke up and he just couldn't walk. He couldn't walk even 100 meters. So his boys go to Gardens International School, which is opposite where we work. And he couldn't even walk from Gardens International to our front door the first day. He was in so much pain. And what do we all do when we're in a lot of pain? We go to the hospital, right? We are worried. We go to the emergency room, which is what he does. He goes and sees an orthopedic surgeon. And the surgeon basically tells him, like, look, Matt, it looks very serious. I think you need to do a surgery. It will cost you, I don't know, 15, 20,000. You will have to go through months of recovery. And Matt was like, whoa, what is happening? I don't want to do this. And maybe a lot of us are in that situation right now where we're in a lot of pain, but we don't want to spend so much money, or we don't want to do surgery, plain and simple, So he tries to go for alternative care. He gets his scans. He goes to a chiropractic center, which has, similar to ours, it's also integrated, but it's mainly for, in his opinion, integrated care for chiropractic, right? And so he goes there, he tries to get some care there, and the chiropractor doesn't touch his back, basically puts his scans up, just hears his story about how the doctor says he needs to do surgery. And the chiropractor says, yeah, Matt, it looks really bad. You have to spend, I don't know, 10,000 here, and you have to see me, and you have to do a traction machine, and it will take another 6 months to a year. And we don't know how it will be, and you better not do any sports and all those kind of things. Something you should know about Matt is that he is a family guy. He has 2 young boys. And he said in that moment, he thought about his boys playing football and how he could never play football with them again. And it was pretty dramatic. He said he felt quite depressed. He felt like there was nothing else he could do. And so he goes home and he calls his brother, who is a physiotherapist in the UK with the NHS. And his brother told him, look, Matt, I think all these doctors are trying to cheat your money. They just want to find the most that they can get out of you, and you should just go see a physio. It sounds like a muscle issue. You should go see a physiotherapist. And I'm sure you guys watching now, you're wondering, didn't she say she's a chiropractor? How come this guy comes to see her? It's because in the end, he comes to our clinic because we're an integrated center with physiotherapists, and lo and behold, of course, the physio isn't available that day, right? So he has to see the chiropractor. And he comes in, he's not interested really to see me. He's just like, okay, whatever. I just need to see somebody to get the process going to see the physio. And so I look at his scans and I say, okay, come, lie face down. Let me have a look at your back, which is part of any history taking process. You listen to somebody's story, you check out whatever scans they have, and then you check their backs, right? We touch and we see with our hands. And he's just like confused. He's like, why do you want to touch my back? Nobody has touched my back. And I'm like, but that's what chiropractic is. It's meant to be very hands-on. And he tells me that the orthopedic surgeon hadn't done any tests on him. The chiropractor hadn't done any tests on him. They basically just go, okay, this is what it is. But after checking his back, I told him, I said, Matt, I don't think you have a disc problem. I don't think you have a spinal problem. Yes, you have some issues according to the scans. There are, some degeneration, some disintegration happening, but not actually your cause. I told him, I said, I think you have a muscle issue which is happening in your glutes. And we have a muscle in our bum, which is called the piriformis. And when we sit too long, that muscle ends up overactivating and pushing on our sciatic nerve, which goes down our leg. So it mimics something like a disc problem. And I said, I think you have piriformis syndrome. It's a more muscular issue. Of course, chiropractic would help, but if you do chiropractic and physiotherapy in our clinic, it would move faster. And I told him, I said, we'll get you out of here in 3 to 6 months. And he, of course, asks us, what's the, $1 million question, right? He goes, how much is the cost? And I'm proud to say that it's been 5 years or something that I've seen Matt, and he has not spent more than 3,000 to 4,000 in our clinic. He has been coming in. Until now, he sees me maybe once every few months just for like a maintenance checkup. He currently lives in Singapore, so I haven't seen him this year actually, especially with MCO. But I want to share you a picture which he shared with me a year after seeing me. So this is Matt climbing Kinabalu. He's the guy in orange, and that's pretty unbelievable. To not be able to walk 100 meters, to be able to climb Kinabalu. When he told me, Sam, I want to climb Kinabalu, I said, Matt, are you sure? I said, you better be ready, you better be exercising. And he said, yeah, Sam, I feel the strongest I've ever been. He felt even stronger than before he started treatment, obviously, because now he could walk properly and he was no longer compensating. So just want to encourage you all out there that, if you have an issue, it's not about chiro or physio. It's more of finding out what is the problem, getting the correct diagnosis and working from there. Yeah. So why is our posture so important, right? Because as you can see from this picture, I'm sure most of us recognize ourselves. We're probably the one with the computer, or maybe even worse, the one with the iPad at the end. If you have kids, the latest thing is that they lie on their stomach and play computer on their beds, right? And this is really bad posture. And the issue with it is that, according to a survey that was done with 20,000 people recently due to MCO, 71% have had a new pain, which or exacerbated, means that you have a pain and now it's gotten worse just due to MCO. And all the reports are there, and it's pretty frightening, because from things like dry and burning itchy eyes, you could eventually get neck pain, back pain, headaches. This is all just over the last 3 to 4 months. And as you can see, the source was in May. Now we're in September. When you watch this, I don't know when you watch it, but you have to imagine from May 2020, MCO only started around the world, basically around March or April. So this was after a month, people already had pain, 71%. Yeah. Let's now watch the video about posture and how it affects it. So here's another very common question that we get. So what actually is posture? So posture is actually your ideal body mass distribution relative to gravity in anything that you do. That means that sitting, there is a certain posture. Standing, there's a certain posture. Sleeping, there's a certain posture. But here's the big one, which everybody has been forgetting over MCO, is that moving also there is a correct posture. So how many of you have had, and so maybe yourself, you know, where this MCO you've tried to get active, you've decided, okay, I'm to do some exercise, I'm gonna, I don't know, get fit, and in the end you have more pain than before. Yeah, that happens, right? Because actually what has been happening is that you're actually moving in the wrong posture and moving with the wrong things set in your body. So sometimes when you sit too long, your pelvis gets stuck in a certain position, and so when you move, now you're moving with the wrong position in your posture and the wrong position in your pelvis. And that's why a lot of people have had more pain over MCO after exercising, right? So let's have a look at our spine. There are curves in our spine naturally. There are curves in our neck, curves in our upper back, and even in our lower back. These curves are called lordosis or kyphosis, and it's meant to help us absorb the shock of when we do things. If you look at this picture again, you can see there are discs in between our vertebrae. The discs are red, and those act as like shock absorbers basically. Over time, if we lose our curvature or we have the wrong posture internally, we end up creating degeneration because the shock absorbers wear out. And as they wear out, the bones start to grind, and that's how we get bone spurring, disc problems, and so on and so forth. Yeah. So as chiropractors, we are always very concerned about your nervous system. We are always talking about your spine. And that's simply because your spine houses your spinal cord. Your spine houses your nervous system. Your nerves are the most important thing. It connects basically your brain to the rest of your body. It can cause posture stress, back pain, neck pain, headaches if the power goes out. So I always describe it to my clients very simply as if you have a hose and you're spraying water, right? So the water comes out very smoothly. But if you put something on the hose at some point, whether it's you step on it or something hits it, what happens to the water coming out? The water basically either comes out spurting like crazy, means it comes out like a lot, and you can imagine that in your body as like electrical impulses, as like those electrical feelings like shocks or pain, sharp pain especially, or you might get less feeling. So you get numbness or tingling and the water just doesn't flow. So we always describe in our body nerves like electricity, and that is one of the issues. Here's another quick video about sitting.
Right now, you're probably sitting down to watch this video, and staying seated for a few minutes to view it is probably okay. But the longer you stay put, the more agitated your body becomes. It sits there counting down the moments until you stand up again and take it for a walk. That may sound ridiculous. Our bodies love to sit, right? Not really. Sure, sitting for brief periods can help us recover from stress or recuperate from exercise. But nowadays, our lifestyles make us sit much more than we move around. And our bodies simply aren't built for such a sedentary existence. In fact, just the opposite is true. The human body is built to move, and you can see evidence of that in the way it's structured. Inside us are over 360 joints and about 700 skeletal muscles that enable easy, fluid motion. The body's unique physical structure gives us the ability to stand up straight against the pull of gravity. Our blood depends on us moving around to be able to circulate properly. Our nerve cells benefit from movement, and our skin is elastic, meaning it molds to our motions. So if every inch of the body is ready and waiting for you to move, what happens when you just don't? Let's start with the backbone of the problem, literally. Your spine is a long structure made of bones and the cartilage discs that sit between them. Joints, muscles, and ligaments that are attached to the bones hold it all together. A common way of sitting is with a curved back and slumped shoulders, a position that puts uneven pressure on your spine. Over time, this causes wear and tear in your spinal discs, overworks certain ligaments and joints, and puts strain on muscles that stretch to accommodate your back's curved position. This hunched shape also shrinks your chest cavity while you sit, meaning your lungs have less space to expand into when you breathe. That's a problem because it temporarily limits the amount of oxygen that fills your lungs and filters into your blood. Around the skeleton are the muscles, nerves, arteries, and veins that form the body's soft tissue layers. The very act of sitting squashes, pressurizes, and compresses, and these more delicate tissues really feel the brunt. Have you ever experienced numbness and swelling in your limbs when you sit? In areas that are the most compressed, your nerves, arteries, and veins can become blocked, which limits nerve signaling, causing the numbness, and reduces blood flow in your limbs, causing them to swell. Sitting for long periods also temporarily deactivates lipoprotein lipase, a special enzyme in the walls of blood capillaries that breaks down fats in the blood. So when you sit, you're not burning fat nearly as well as when you move around. What effect does all of this stasis have on the brain? Most of the time, you probably sit down to use your brain, but ironically, lengthy periods of sitting actually run counter to this goal. Being stationary reduces blood flow and the amount of oxygen entering your bloodstream through your lungs. Your brain requires both of those things to remain alert, so your concentration levels will most likely dip as your brain activity slows. Unfortunately, the ill effects of being seated don't only exist in the short term. Recent studies have found that sitting for long periods is linked with some types of cancers and heart disease and can contribute to diabetes, kidney, and liver problems. In fact, researchers have worked out that worldwide, inactivity causes about 9% of premature deaths a year. That's over 5 million people. So what seems like such a harmless habit actually has the power to change our health. But luckily, the solutions to this mounting threat are simple and intuitive. When you have no choice but to sit, try switching the slouch for a straighter spine. And when you don't have to be bound to your seat, aim to move around much more, perhaps by setting a reminder to yourself to get up every half hour. But mostly, just appreciate that bodies are built for motion, not for stillness. In fact, since the video's almost over, why not stand up and stretch right now? Treat your body to a walk. It'll thank you later.
All right, so that's what sitting does to our back, and it's quite serious, isn't it? Another common thing that we all have nowadays besides sitting is technology. So if you look at this picture, do we recognize it? That's probably us this morning. If we go up a lift, especially, I always tell people when you go up a lift, you see that's you. That's all your colleagues looking down at your phone, not wanting to have any conversation with people. And what happens after that? We say, oh, at the end of the day, my neck hurts so much and I don't know why. We always say we don't know why, and that's actually the reason, yeah? So let's look at this video for a second. As you could see, the neck started in quite a nice curved position, but over time, as it progresses, it gets straighter and straighter and straighter. And as it gets straighter, like I mentioned before, it loses its curvature, the discs lose their health, and it gets into this weird position. And you can start to see degeneration happening. It gets not stable, and that's why bone spurs start forming as well. Let's look at this next slide. It's a bit clearer. So this is what we call spondylosis, very common if you go to a doctor and you have neck pain, and if they take an MRI or an X-ray and they see spondylosis, they'll always tell you, I can't do anything about it, just, take some Panadol and just bear with the pain. And that's what they always say, because they're not going to do surgery on your neck for something like this. It's what we call tech neck, eye posture. It's all catchy phrases for the same thing, which is just basically due to bone and degeneration. Your head is the weight of a bowling ball, and your neck is a very small structure underneath. The bones are. And so the head, if it keeps looking forward, it gets heavier and heavier and heavier. And the only thing that holds your head from rolling off your neck are basically all the muscles in your neck. And that's why you have so much pain and so much neck tension, because it's trying to hold your head back. It's trying to keep it in the correct position. If not, it just keeps getting worse and worse. So, okay, we see all these things and we get a little bit like, oh man, what am I going to do, right? Like, I can't get rid of my computer. I can't get rid of my phone. I can't get rid of sitting down. So what can I do? Well, here's the good news, right? You can prevent sitting disease. It's not something that is permanent. It's not something that will cause problems for you forever if you know the right steps to deter it from happening. So solution number one is actually what we call diaphragmatic breathing. This is when you put one hand on your stomach and one on your chest, and you take a deep breath and you breathe out. So when you take a deep breath, everybody expands what we call the chest muscles first. You breathe in like this, like, right? And that's actually wrong. You should be actually expanding your diaphragmatic muscles. And there's an easy way to activate it. You basically put your hands like this around your waist area and you fake a laugh, or you make a real laugh and you just go ha ha ha. If you do that kind of a sound, you would feel your stomach get hard. And those are the muscles you should actually be engaging when you breathe. And so you have to practice this at home. It's not so easy, of course. If this was a live talk, I would be showing you in person, but you just have to practice. So now when you put your hand on your chest and one on your stomach, and when you breathe in, you should be engaging those side muscles in your stomach and not the chest breathing in and out, yeah? The second thing is actually what we call a posture break. So this is very simple. Actually, we always tell clients every 30 minutes, move for 30 seconds. What we mean by move is not actually, you don't have to get up and walk. You could actually just be in your desk, and what you could do is overarch everything. So you would overarch your shoulders, you overarch your lower back, and you pull your neck in like that. And if you hold it for 10 seconds and you release and you relax, do it 3 times, that's already 30 seconds. And a posture break is basically just a break in your posture. So what I mean by this is, instead of just sitting and hunching all the time, even if you sit very straight for 30 seconds, it's a break. Yeah. So just reset your posture, move around a little bit. If you can stand up, do some squats, engage your glutes, engage your core. That would help you a lot. The third solution is actually to stand up and move around. This one is very common nowadays. Everybody's looking for standing desks and trying to move around a little bit more rather than sitting down. I highly encourage it. There are stands that you could buy from IKEA, I've heard, have standing desks, or you could even Google online or get something custom made. Number 4 is walk and work. This is something that people are finding out now at ABSEO, right? You know, all of you, maybe you're listening to this talk, but you don't have to sit down while listening to it. You know, you could actually be playing it on your phone and you're moving around while you're listening to me talk. Or if you're in a meeting, and instead of just sitting down for the meeting, if you can stand up, walk around the room. You know, if you're on a call, you can still be moving, so you don't actually have to be sitting all the time. The 5th one is what we call active sitting. Yet again, another great idea for home. Get an exercise ball, start engaging your core, start being able to flex your pelvis in a posterior and anterior rotation. Just sort of, you know, keep flexing it. So as it flexes, you're engaging your core. You're actually doing some exercise, which is good for you as well. And this is what we call active sitting. You could also invest in something like a back joy, which we do sell at our office, or you can always buy it from Mid Valley, or I think even Watson's and stuff sells it, or Caring Pharmacy. It basically just helps you keep your pelvis in a neutral position. Of course, if you do all these things and it still doesn't work and you still have pain, it means that you have something more underlying happening, probably some what we call structural imperfection or structural problems. So maybe your vertebrae needs an alignment, it's just misaligned. And so then you should come and see somebody, come and see us at our clinic, check your posture, check your spine, find out what actually is happening. And then usually, if after doing this step and everything is good, you can go back to solution 1 to 5 and it should be pretty good. So we have a video now just to give you a little bit of a video idea of the past 5 solutions that we mentioned. Nowadays, we are constantly on our laptops and mobile devices. At home, we can try our best to reduce postural stress by moving around and exercising. At work, however, sometimes we just cannot afford those luxuries. We are bound to our desks and develop poor postural habits. Here at HealthWorks, we recommend all our patients to implement posture breaks. Here's how you can implement a posture break at your desk. If you're required to sit, you can hyper out your lower back, upper back, and tuck in your chin. Hold this position for 10 seconds, engaging your postural muscles. You may repeat this process every 30 minutes. This will help you return to a healthy range of posture. You could also use a standing desk. When we hunch over at a desk all day, this causes our lungs to not be able to expand fully. Here's how you breathe properly. You can put one hand on your chest and another on your core. Take a deep breath and inhale for 4 seconds. Exhale for 6 seconds. Your chest should not move, but you should feel your diaphragm expand and relax. Repeat 5 times. Instead of sitting on a chair at work, why not try engaging your core by sitting on a ball, or a back joy, or a similar device that helps you keep your pelvis in a neutral position. However, the best posture break is to give your posture a break. This is done by moving around for 30 seconds every 30 minutes. If you have any questions or any joint or back-related pain, feel free to give us a call at HealthWorks. Our postural and spinal experts would love to help you move, get fit, and be well. Thanks for watching, and we hope to see you soon. Yep, so here's a little bit of a recap. So like we mentioned before, number 1 is breathing. Number 2, posture breaks, and now you know how to do it. We've shown you a video on it. Number 3, standing up. Number 4, walking around rather than sitting all the time. 5, if you have to sit, try to sit actively, engaging your core. And number 6, of course, if you need to check your posture and check your spine, you know where to find us. So this is a video on our clinic.
We live in a high-stress world. We sit too much, move too little, and work too hard, leaving us tired, in pain, and out of shape. Our posture and spinal health are declining at the speed of advancing technology. Back pain now affects more than 80% of our population. That's 4 out of 5 people. Are you one of them? Life is busy. To maintain a healthy body along the way, we need to keep moving. The pain we experience today is caused less by trauma and injury, but more from poor posture and inactive lifestyle. Our bodies, powered by healthy spines, are designed to keep you moving, pushing boundaries, and overcoming life's demands. Back pain can certainly hold you back, but it doesn't have you anymore. At HealthWorks, our team of chiropractors, physiotherapists, movement specialists, and fitness trainers work together to help you reset your posture, restore your spinal health, and reactivate your body so you can move better, get fit, and be well. It's time you take back what's yours. Reignite your life today at HealthWorks.
All right, so that's us at HealthWorks. We are a chiropractic physiotherapy fitness center. We are integrated in our care, which means that it's very specific to you. We don't just have a standard layout for everybody, which means that we don't see, okay, everybody that comes in, there is a certain number of sessions. You have to do physio or you have to do chiro. We don't say, okay, you have to see the physio after every session. There's no such thing. We actually personalize it to you. So we do what we call a specialized history taking. We check your back, we touch and we see, and then we see what you need, and then we recommend it for you. So at our clinic, This is what we do on your first consultation, your first visit when you come in. We take, like I said, a history taking, we do a physical assessment, orthopedic testing, similar to orthopedic surgeons, neurological examination. We do a posture screen. And if necessary, we would send you over to the physio, and the physio then would do functional physiotherapy assessment and movement analysis. Or if you need to see physio first, it's upside down. You would see the physio first, they would do the history taking, they would do the assessment, the analysis, and then if you need chiropractic, they would pass you over. So it's very specialized to you and what your concerns are of the day. Usually when somebody attends our talk, we actually give you all a special rate of only $99. This is a much reduced rate because everybody who comes to our talk spends time with us and you get to know us, and we really appreciate you coming. So that's why there is a reduced rate. I just want to remind you guys about Matt and how it was for him when he couldn't find a diagnosis. Just the encouragement is that, you know, if you guys ever come in, it's really not so much about seeking treatment, but I always tell clients, you just need to know what's happening with your back. Once you know, you can decide what you want to do with it. If you don't really know what's happening, then it would just be going on like, okay, you know, Dr. Sam, I have this pain. Why? I don't know. How come I have this neck pain? And you don't really know the cause. You don't really know the cure. So once we can find out what your diagnosis is, we can give you a suitable solution that matches you. This is another bunch of my clients. So the mom is Intan and the husband's name is Rudy, and then it's Ava and Erin. But I just want to share with you a little bit about Ava, who's actually the little girl in pink. So her mom started seeing me for her back, similar story, you know, supposed to go for surgery, things like that. And she got much better with chiropractic and physiotherapy at our clinic. And she asks me, she says, Sam, my daughter at that time, I think was 6 years old. And she says she always has hip pain and she always needs a massage. She fell off her baby chair when she was about 2 years old. And since then, she's had hip problems and just has a lot of pain. And she said, can you help me? And I told her, I said, well, I can try. I'm not sure. You know, she's 6 years old. We need to do x-rays. We need to do scans, which is what our clinic would send you for if necessary. So the daughter went out for x-rays. She brought it back. We have a day tool, which is what we call report of findings, which is completely included in the consultation price. We don't charge you for it because we want to find out the diagnosis. Good news is that the daughter didn't have any broken bones. She didn't have any fractures, nothing structurally wrong with her hip, just that she has pain. And so then we said, okay, we'll do manipulation and we'll do a little bit of muscle work and see how it goes because she's so young. And over a course of, I think, about a month or two, her pain completely disappeared. She now goes for taekwondo, she goes for dancing, she does children's yoga, and she's totally fine and healthy. This was taken about, I think, 2 years ago. So they're completely happy now. Ava recommends me to her grandparents. I see the family, the entire extended family as well. And everybody now only comes to me for maintenance care. So just want to encourage you guys again, you know, even if you know a child or an old person, we can also still help you find a suitable diagnosis and a suitable care plan. Yep. So thank you so much for coming for the talk. Since it's MCO and since you're in our talk during MCO, we have an even better promotion. It's actually only 50 ringgit right now to come and see us. We do exactly the same thing. We don't skip on any of the steps. We give you the proper history taking. We do the proper examination because at the end of the day, like I said, the diagnosis is the most important. So if you guys are interested in coming in, all our details will be shared with you. Thank you so much for listening to me today. And thank you so much for spending your time with us today. All right. Thank you.